Hello, I'm Dr. Jennifer Fortune, a Research Fellow at the CP Life Research Centre at the Royal College of Surgeons in Ireland. I'll be presenting a summary of our findings on behalf of our study team from our paper titled Transition from Child-Adult Health Services for Young People with Cerebral Palsy in Ireland, Influencing Factors at Multiple Ecological Levels. Moving from childhood to adulthood is a journey marked by significant milestones and challenges for any young person. But for young people with cerebral palsy, the path to adulthood often has unique hurdles to overcome. We wanted to find out more about how young people with cerebral palsy, their parents, and health professionals experience the transition to adult services in Ireland. We spoke to 21 parents and young adults and 27 service providers to find out more about the transition from child to adult health services in Ireland. We completed semi-structured interviews. We audio recorded the interviews, transcribed them, and then analysed them using a tool called framework analysis. We organised the interview findings using an ecological approach inspired by Bronfenbrenner's ecological systems theory. This model highlights various systems surrounding the individual young person: the microsystem, the mesosystem, and the exosystem. This model helped us identify the multi-level factors that interact to influence the transition to adult services. At the centre of the model, young people described the move from child to adult services as often confusing and overwhelming due to a lack of information and planning, which left them feeling lost and unsupported. The transition was influenced by various factors surrounding the young person at multiple levels. Microsystem interactions with family and health professionals influenced transition knowledge and preparation. Young people often relied on their parents for transition information. However, parents encountered difficulties imparting information because of shared knowledge gaps with young people. Service providers recognise the importance of providing information and preparation, but often struggled with limited clarity on eligible and available adult supports, and many had limited experience of the transition process. At the mesosystem level, connections between the people surrounding the young person influenced their transition. Poor communication between parents and health professionals impacted transition. Health professionals often did not want to overwhelm families, so sometimes held back from initiating discussions. This left parents to drive the process, perpetuating a cycle of parents taking charge of transition. Connections between health professionals also impacted transition. Effective transition requires input from both child and adult services, but there is limited formal connections and communications between them. Many different agencies were involved in transition, but poor interagency collaboration and partnerships impacted the process. Finally, the exosystem level included larger systems and policies that indirectly influence young people's transition. There were fewer adult health services available, and the ones that did exist were lacking healthcare coordination equivalent to that of children's services. Staffing challenges, high-pressure workloads, overstretched services, and long waiting lists hindered the provision of transitional care. Inequitable geographic distribution of services in adulthood often led to postcode lotteries for access. A lack of national transition policy or framework to aspire to made consistent delivery of transition difficult. And finally, limited prioritisation of funding for adult services and supports impacted transition. At each level of the system, interview participants made suggestions for how to improve the transition process. Young people and parents stressed the need for early planning to identify service options, gather information, and connect with future services. Young people expressed a desire for a comprehensive transfer review involving all departments to assess their therapy needs, make necessary referrals, and offer guidance on accessing adult support. They also highlight the importance of being informed in advance about their discharge meeting to prepare questions and increase their engagement in transition. At the microsystem level, parents often relied on advice from other parents who had gone through the transition process, and they stressed the importance of having access to peer support during this time. Service providers stressed the need for a comprehensive directory containing information about health professional roles, service structures, available services, and key contact details to facilitate the transition process. At the mesosystem level, service providers and parents stressed the need for a clear handover period with collaboration between paediatric and adult providers for a successful transition. This gradual handover would allow detailed information transfer and provide reassurance to families and help young people connect with their adult team. Parents and service providers also suggested using electronic patient records to improve information sharing across different agencies and sectors. Finally, at the ecosystem level, many service providers called for a dedicated transition coordinator to improve clarity and accountability in the transition process. Service providers also highlighted the need for a national framework to outline the transition process and specify available supports at each stage. And service providers and parents emphasised the importance of having access to knowledgeable, multidisciplinary adult teams who could provide comprehensive care for young people. So to conclude, transition is a multifaceted process shaped by interactions between individuals, services, and systems at various levels. By recognising and understanding these interconnected relationships, we can develop comprehensive interventions that address the complexity of transition effectively. Leveraging multidimensional approaches rather than targeting isolated behaviours is key to providing holistic support. And through collaborative efforts among researchers, practitioners, and policymakers, we can implement interventions that promote successful transition and improve outcomes for young people. Thank you very much to the Central Media Clinic and Health Research Board for funding this research, and for all our public involvement advisory members for their advice throughout the project. If you'd like to find out more about the work done by the CP Live Research Centre, you can visit our website by scanning the QR code below.